This presentation is on nurse burnout, issues and solutions by Jordan Wardabaugh. So what is nurse burnout? Nursing is a stressful profession that can have both a mental and physical toll on the body. When work-related stress exceeds the adaptive levels and becomes chronic, it is given the name burnout. According to Bandiera and Figueiredo de Martino, 2016, the term comes from the English terms burn and out, and means someone who does not have more energy. It is the collapse of adaptive capacity of the individual. It is when one has reached the limit of his efforts, their efforts no longer work, and they are finally burned out. Burnout saps energy, leaving nurses feeling hopeless. At its peak, it can lead to mental health issues like depression and anxiety. Those who experience burnout often feel like they are no longer able to fully commit to their job. This leads to slow decline, causing some to never return to the profession. Estimates suggest that nursing shortages will reach 260,000 to 400,000 by 2025. Brown 2018 mentions that nurses are leaving the profession in part because of burnout, which is worsening the nursing shortage. Such shortages have both a nationwide and global impact. According to What Nurses Want, findings from the National Survey on Workplace Climate and Well-being released in 2016, almost one-third of nurses have considered leaving their profession due to rising work demands and burnout. Rising tolls are seen as more and more nurses are experiencing the burden of nurse burnout. According to Fidel 2017, 71% of nurses feel that they are overworked. 67% listed work intensification as a major issue, and 54% felt reluctant about voicing concerns due to fear of negative consequences. Workload was identified in several of the studies as a major factor to nurse burnout. Nursing turnover, increased nurse-to-patient ratios, and inexperienced co-workers also impacted workload. Workload impacts nurses' personal feelings of accomplishment and their ability to meet patients' physical and psychological needs, contributing to burnout. The signs and symptoms of nurse burnout include those that affect both physical and emotional health. These include fatigue, loss of motivation, detachment, reduced productivity, cynicism, and low self-esteem. Burnout is fundamentally different to regular stress. It is characterized instead by feelings of emptiness and desolation. Causes of nurse burnout include unrealistic workload, exposure to trauma, staffing shortages, and lack of recognition. Brown 2018 also mentions factors such as moral distress, poor support systems, bullying, and workplace violence. Moral distress was identified as a contributing factor in the development of depersonalization. Lack of training regarding death and dying, as well as issues with emotional support of patients and families, also contributed to moral distress. Ethical dilemmas is another factor that affects nurse burnout. Limited training and resources may increase stress levels for nurses in difficult situations. Brown 2018 mentions that coworker support may be limited due to inexperience and larger patient assignments. While patients need to receive excellent care, healthcare providers also need adequate resources to maintain these standards. Advancements in technology, insurance changes and demands, and the vast amount of new education needed to understand current and expanding treatment and disease knowledge and processes are other causes of burnout. The effects caused by nurse burnout include mistakes and medication errors, absenteeism, resorting to food, drugs, or alcohol to cope, resigning from the job due to inability to commit, and poor patient outcomes. There is a large prevalence of overweight nurses. As nurses attempt to reverse the burnout experienced, they tend to use food and other substances to cope in efforts of staying on top of their demands. This can lead to unhealthy weight gain and other serious health problems. Many also find it difficult to catch a lunch break and may even skip out on healthy evening meals due to family obligations and lifestyle outside of work. This can have a detrimental effect on their overall health and well-being. Burnout has been known to cause poor patient satisfaction scores and increased infection rates. Patients and families may be less satisfied with care and experience inferior outcomes when nurses experience burnout. Stress can also be perceived by other members of the healthcare team through interpersonal relationships. As a result, this can lead to poor patient outcomes. Burnout may cause nurses to abandon their work situations, leading to increased stress of the other nurses. As stress is prolonged, burnout becomes intensified, leading to nurses becoming callous and uncaring towards patients and disgruntled about their work environment. This can have a major impact on patient satisfaction scores. With increases in workload leading to burnout, staff nurses become less able to focus on their patients, less attentive to changes in patient status, and less attentive to patient clinical signs and conditions. Resiliency is an individual's ability to overcome an adverse situation with optimism and self-control. Brown 2018 mentions that high resiliency in nurses is correlated with personality traits of optimism, self-efficacy, hope, and flexibility. In a cross-sectional survey conducted by 2 large acute care university hospitals, study participants agreed that staff nurses must be stress-resistant and must have a strong capacity for self-management in order to cope with daily hassles. Stress resistance is important for competent nurses as it is an essential component for patients, nurses themselves, colleagues, and the hospital. Every effort must be made to develop programs that support nurses with the needed resources and tools to overcome adversity. Nurse leaders should understand the challenges their nurse colleagues face and how they respond to these challenges. Brown 2018 suggests that coping strategies, which are determined by a nurse's level of resiliency, are important for nurses to use in overcoming a stressful environment. It is also important that nurses express the ability to have a sense of hope and meaning. Because of the detrimental effects of burnout, it is critical that healthcare organizations and leaders find ways to support the development of resiliency among nurses. This will lead to a healthy workforce. Mindfulness-based stress reduction training, emotional distancing, conflict training, and event trigger exercises were found to have a positive impact on nurse resiliency. Workshops focusing on these strategies can assist in providing resources and techniques for nurses to implement during stressful situations. Training incorporates several strategies that improve self-care. Other programs to encourage self-healing and coping include group sessions and individual exercises to develop resiliency characteristics and strategies. Implementations by organizational leaders must be made. Such implementations may include written exercises, relaxation techniques, exercise programs, identification of event triggers, and mindfulness training. Burnout solutions have been shown to improve the physical and mental health of nurses, patient satisfaction, and the organization as a whole. On-site resources need and must be made available. These include employee assistance programs, pastoral care, counselor or psychologist, psychiatric nurse specialist, and support groups. Lag time between scheduling these appointments and getting time off must be made available to encourage participation of such interventions. According to Henry 2014, staff retreats have been shown to have a near positive impact on nurses' health and well-being. In a study conducted involving 150 oncology nurses from a large cancer center in eastern United States, an overnight staff renewal retreat proved to promote wellness. The retreat promoted engaging staff outside of the work setting to relax, have fun, revisit self-care and reflection, and rekindle spirits. Nurses who attended the retreat stated that they felt rejuvenated and professionally re-inspired. Despite lack of evaluation tools, the participants acknowledged appreciation for the unique experience of fun, personal growth, and knowledge. Expressive writing workshops are another great intervention to promote self-care. Journaling was used in a study of 40 nurses. Participants were presented with information on balance, privacy, honesty, silence, attention, structure, and reflection. The authors reported overwhelmingly positive responses from patient group participants and from healthcare providers who used structured journaling to aid in nurse burnout. According to Brown 2018, further research is needed to validate correlations. Resiliency research can help leaders identify characteristics in new nurses and implement resiliency strategies to maintain a healthy workforce. A comprehensive understanding of nurses' psychosocial work environment is necessary to respond to complex patient needs. Many nurses expressed stimulating factors that help to prevent nurse burnout. These include receiving sufficient recognition from patients and colleagues, interdisciplinary collaboration, a challenging work environment, importance of loving your work, and getting social support from colleagues. Nurse managers must be aware and make every effort to support staff nurses in their daily activities in order to facilitate teamwork and collaboration. It is important to consider differences between acceptable and unacceptable workload as these determine the stress and burnout of each nurse. Unacceptable workload must be considered as it does not meet patient care demands, resulting in poor quality care. It has been determined that the hospital goal of patient-centeredness often is neglected and affects nurses in a negative way. Staff nurses will use coping mechanisms such as letting go and being less accessible and approachable. While interventions of nurses showed positive outcomes as measured by participant comments, limitations do exist due to lack of objective measurement tools and experimental design to evaluate efficacy. Despite these limitations, it can be argued that organizations that implement burnout interventions may experience increased retention and reduced turnover and performance problems, leading to overall increases in patient satisfaction.